Anxiety, depression in the brain are best understood as a systems-level problem rather than a single chemical imbalance. In a clinical neuroscience framework, these conditions emerge when neural circuits for threat detection, emotional regulation, reward processing, and bodily arousal become dysregulated over time. Visualize a realistic hospital-grade brain imaging environment where a neuroscientist studies a high-resolution MRI scan while nearby screens display functional connectivity maps, cortisol pathways, and synaptic signaling diagrams. The amygdala, a deep limbic structure, acts as an early warning system. Under persistent stress, its activity can become over-responsive, causing neutral situations to be interpreted as threats. In a realistic close-up of a transparent brain visualization, the amygdala glows intensely in relation to the prefrontal cortex, illustrating excessive alarm signaling. The prefrontal cortex, which supports planning, perspective-taking, and impulse control, may lose regulatory strength, making worry harder to interrupt and emotional reactions more difficult to contain. Depression involves another pattern. A clinician examines a digital brain model showing reduced activity in reward circuits that include the ventral striatum and nucleus accumbens. These regions normally respond to motivation, achievement, and pleasurable experiences. When their signaling weakens, people may feel anhedonia, low drive, and emotional flattening. The hippocampus, important for memory integration and stress modulation, may also be affected by prolonged exposure to stress hormones, especially cortisol. At the cellular level, synapses adapt constantly. A realistic microscopic render shows neurotransmitter release across a synaptic cleft, with serotonin, norepinephrine, and dopamine represented as precise molecular activity rather than simplistic symbols. In anxiety and depression, the balance of these signaling systems can shift, but the brain is more complex than a single molecule explanation. Neuroplasticity means circuits can strengthen, weaken, and reorganize in response to experience, sleep, exercise, psychotherapy, and medication. In one ultra-realistic hospital scene, a patient speaks with a psychiatrist while on a monitor. The clinician highlights amygdala prefrontal interaction, autonomic arousal, and circadian rhythm disruption. The visual should emphasize that symptoms are not signs of weakness. They are measurable changes in brain function, body regulation, and behavior. Rapid heartbeat, muscle tension, reduced concentration, and insomnia reflect the brain-body loop running in overdrive. Another detailed shot can show a calm, therapeutic setting, contrasted with a stressed neural network overlay. Cognitive behavioral therapy can be represented as a guided process in which repeated reframing gradually strengthens top-down control pathways. Medication can be shown as a pharmacological bridge that helps restore signaling stability, allowing the brain to recover its capacity for adaptation. The closing image should be a realistic, recovery-oriented composition, a person walking outdoors at sunrise with a subtle overlay of balanced neural circuitry and regulated brain networks. The scientific message is clear. Anxiety and depression are not simply emotions gone wrong. They are conditions in which brain circuits, stress biology, and lived experience interact. Because those systems are dynamic, recovery is possible, and the brain can change in measurable, meaningful ways.